However, a new single pill drug for HIV treatment has been developed after extensive clinical trials in the US. It's called Quad.
Recently, we've learned about major medical breakthroughs in HIV/AIDS treatments and possible cures.
Let's talk more about this toddler that was found to be functionally cured of HIV after having been born with the virus.
Despite the medical gains, there are still many misconceptions, myths, and misunderstandings being fueled by the media surrounding HIV and AIDS.
It's been exactly 30 years since the first confirmed cases of AIDS were reported, and here at the Pasteur Institute in Paris, scientists have spent the last 3 decades studying the HIV virus. Now researchers claim that early medical intervention may lead to a functional cure for AIDS.
Let's take a look at the truth and the facts everyone should know about HIV/AIDS, because HIV/AIDS is still a big deal. In this program, we're going to take a no-hype, no-fear, and factual look at HIV/AIDS. What is it? How do people contract the virus? And what steps need to be taken to prevent infection? We'll also hear from medical experts and several people who are living with the HIV/AIDS virus. HIV stands for Human Immunodeficiency Virus, and AIDS is an acronym for Acquired Immunodeficiency Syndrome. AIDS is the final stage of HIV disease, which causes severe damage to the immune system. Today, many people have the impression and an attitude that HIV is nothing more than a disease that doesn't really affect them. They think it's a disease they shouldn't be concerned with because there are pills that can help treat the disease. Ask yourself, are you concerned about contracting HIV/AIDS?
So people think that getting HIV/AIDS is not a big deal anymore. They are so wrong. This is not a disease that anybody wants to mess with. True, people are not dying like they used to, but this is a disease that just wrecks the body and racks the body, and you are forced to take medication daily. So this is not just your run-of-the-mill, oh, I got HIV/AIDS, no big deal. We have 2 messages. One is for folks who are living with the virus, which is you can live with the virus. Yay, good news that you don't have an automatic death sentence. But the message that we give to folks who are not infected is you don't want to mess with this disease. And I think what's happened is that people who are not infected have latched on to the message that we give people with AIDS, which is you can live with this, it's manageable. And we say, whoa, 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 that's not the message we want to give you. Yours is stay away from this virus.
Well, over the last 4 decades, since the first HIV cases, AIDS cases were reported in 1981, one of the biggest ways that the public perception has changed, one of the biggest reasons the perception has changed is because starting in 1996, we finally had effective treatment for HIV infection, so that no longer was HIV infection necessarily a fatal illness. So in the years before that, when HIV infection really was tantamount to a death sentence, you could be pretty certain that if you were diagnosed HIV positive, that at some point you were going to get sick and die. And so the shift in perception that treatment has brought about has had positive benefits, because no longer is it seen as a death sentence, but at the same time it has made people a little more casual about it, so that people at higher risk, young gay men, young men of color, in particular women of color, think that, well, gee, it's not something I need to worry about quite as much as I used to, because if I get HIV infection, I can get effective treatment, and that'll be that. So that treatment has really changed the public perception of HIV.
HIV can be transmitted from an infected person to another through blood, semen, vaginal secretions, and breast milk. The risk for HIV for most young people begins when they become sexually active or if they start injecting drugs.
When I'm talking to a patient about how HIV is acquired, I think most everybody understands that intercourse is your main risk factor. And what I'm talking about here is penetration. I'm talking about either vaginal or rectal penetration with completion of a sexual act so that someone is ejaculating. Those are by far and away your highest risk for acquiring HIV. What probably is less well understood is that oral sex has a lower risk for contracting HIV, but it is not zero. There is definitely some concern that you can contract HIV that way. Besides sexual transmission, the other things that we have to be concerned about are needle use. People can share needles and transmit HIV through injection drug use. The other way that HIV is transmitted, mother to child. That's a huge problem worldwide.
Once transmitted and blood is infected, HIV can begin to attack the body's immune system. Red and white blood cells flow through our bodies. White blood cells are a very important part of the body's defense system. Healthy white blood cells, or leukocytes, engulf and digest bacteria and fungi, defending the body against infectious diseases and foreign materials. HIV destroys a type of white blood cell that fights infections, called the T lymphocyte, also known as T cell. T cells invaded by the virus can no longer properly fight infections. When HIV destroys these lymphocytes, the immune system becomes weak and people can get serious infections that they normally wouldn't get. A person is diagnosed with AIDS when they have a very low number of T cells or show signs of a serious infection. Here are some additional facts you need to know about the transmission of HIV. HIV cannot survive for very long outside of the body, and it cannot be transmitted through your routine daily activities. You can't get HIV from a toilet seat, sharing food utensils, and you can't transmit or get HIV from shaking hands or kissing. And you cannot get HIV/AIDS from an insect bite or sting.
Well, it's a pretty long story how I contracted HIV. First, it had to do with drugs. My father was a big-time drug dealer in New York, from what I was told, and my mom became pregnant. She didn't know she had HIV, and then I was born with it.
I know exactly when I contracted the disease. Unfortunately, I was having unprotected sex, and that led me to become HIV positive.
The 6 is when I found out that I had HIV, because I became real sick. I was going through a lot of surgeries, having a lot of ear infections, so they were like, what's going on? So they ended up just checking my mother, and my mother came out positive. And I was just the last one to be checked because my little sister was born. So they checked her first. And no, my 2 little sisters don't have it. I was the one that ended up with it.
Today, in the United States, HIV/AIDS is increasingly treated as a long-term chronic illness. People who live with a chronic illness such as HIV/AIDS often face medical, personal, and social uncertainty.
When my mom found out that she had HIV, from what I remember, she was angry. She was an angry person. I was the main one targeted. I was basically the ugly duckling in my family. I ended up being in a safe home at the age of 10 and going to my first foster home.
When I first found out that I had HIV, I was scared, mortified. I wondered how it had happened. I wondered what I would do about it. I wondered where I would go for help with it. I wondered how long I would live.
With a diagnosis of HIV/AIDS, many people face the unpredictability and stresses of their personal finances and personal relationships, especially in dating and long-term relationships, because they run the risk of infecting others.
At first, when I became to go to high school and all that, it was kind of hard. I felt like awkward. I didn't know how to tell. Let's say I wanted to become in a relationship with someone, I didn't know how to tell them.
Told several people over the period of time that I've been positive about my status. One in particular that had a negative reaction was this guy that I was seeing. He wasn't informed as much about the disease, and therefore he took it kind of negatively. The
way my HIV impacted my family and friends, I wouldn't say so much my friends, but my family, I don't talk to them. We no longer speak. I don't speak to my sister, nobody. Basically, my family is my husband. The big impact in my life, my family not being here.
So I have KDAP for my medications. Without that, I wouldn't be able to afford the medications that I take. Life
now, it's hard because I can't be surrounded with a lot of people who are sick. It could be a flu, any little thing. I'll catch it like that. I used to work as a CNA and I got fired because of the fact that I was always getting sick and calling out, and they weren't understanding.
There are plenty of things that I would go back and change. I would have chosen to have safe sex every time because it only takes one time. I would have not have slept with as many partners as I did. Would have definitely cut down on some of the drug usage that I had. I believe that all those things kind of led me down the path.
In the United States, over 1.1 million persons aged 13 years and older are living with HIV infection. Of that number, over 207,000 people are unaware of their infection. Because there is currently no vaccine for HIV, we all need to take preventative steps to avoid infection. Sexual contact with a partner who is HIV positive is the most common route to HIV infection.
I think the number one barrier to stopping this disease is the mindset that it's not going to happen to me. It really only takes one sexual partner who has HIV/AIDS. It only takes one needle that's already infected with HIV/AIDS to get into your bloodstream. But people walk around saying, never going to happen to me. Oh, I'm not one of those people. Ignorance and denial are those are the two barriers that will stop us having any progress around ending this disease in its tracks.
Having responsible relationships and having safe sex is about exercising good judgment, right? Well, what impairs your judgment? Alcohol, drugs. Drugs and alcohol are prevalent through all ages, but again, it's that whole notion of letting your guard down, impairing your judgment. Probably safe sex and alcohol and drugs don't mix very well.
It's important for folks who are just starting to date to know their partner and to have conversations that are open and honest. There are countless women who have become infected with HIV/AIDS because their partner said, oh honey, oh baby, you're the only one. Oh, I don't sleep around. Oh, I've been tested, trust me. Too many women are living with HIV/AIDS because they bought that story. And if you see any warning signs that lead you to believe that what he's telling you isn't the truth, run. Run fast.
Being educated on how HIV can spread and avoiding high-risk situations is important. But effective HIV prevention also involves knowing your HIV status. Over 200,000 people in the United States aren't even aware they're infected. That's why it's recommended that everyone between the ages of 13 and 64 get tested once a year. But if you engage in high-risk behaviors, you should get tested more frequently. You have the information you need to make safe choices and protect yourself from getting infected. HIV/AIDS is not a death sentence anymore, that's true, but it's still a big deal.
I would tell any young person that you always need to have protected sex. There's never a reason or time not to. You can't particularly look at the person and say, oh, he doesn't have HIV. That was my thought process. Although it's not a death sentence, it's certainly nothing that anybody wants to deal with on a daily basis. Although it has come a long way, there are still certain barriers and certain issues that you just have to deal with that are the repercussions of contracting.
There are some women out there and some men that they get lucky just to have sex for one day. Just anybody. They get lucky because they don't get HIV, they don't get herpes, they don't get all that. Just because you slept one day with that person, but the next day it could happen, you know? So don't think that it's not going to happen to you.